Assalamualaikum and hi, I'm Nur Akbar bin Nurahan. ID student is 2022615912. Want to make a presentation for subject exercise nutrition. Code SPS 482. Today I want to present the title about eating disorder. What are eating disorder? Eating disorder are behavioral condition characterized by self and presenting distribute in eating behavior and associated distressing thought and emotional. There can be very serious condition affecting physical, physiological, psychological, and social function. Type of eating disorder include anorexia nervosa, bulimia nervosa, binge eating disorder, avoided restrictive food intake disorder, other certified finding in eating disorder, pica, and rumination disorder. Taken together, eating disorder affect up to 5% of the population, most often developed in adolescents and young adulthood. Several, especially anorexia nervosa and bulimia nervosa, are more common in women, but they can all occur at any age and affect any gender. Eating disorders are often associated with preoccupation with food, weight or shape, or with anxiety about eating or the consequence of eating certain food. Behavior associated with eating disorder including restricted eating or avoidance of certain food, being eating, purging by vomiting, or laxative measure of compulsive exercise. This behavior can become driven in a way that appears similar to an addiction. Eating disorder often co-occur with other psychiatric disorder, most commonly mood and anxiety disorder, obsessive compulsive disorder, and alcohol and substance use disorder. Evidence suggests the genes and heritability play a part in why some people higher risk for an disorder, but this disorder can also affect those with no family history of condition. Type of eating disorder. Number one is anorexia nervosa. Anorexia nervosa is characterized by starvation and weight loss, resulting in low weight for height and age. Anorexia has the highest mostly of any pediatric diagnosis of the weight use disorder and can be a very serious condition. Body mass index or BMI, a measure of weight for height, is typically under 18.5 in adult individual with anorexia nervosa. There are two subtypes of anorexia nervosa. Number one is restricting type, in which individual lost weight primarily by dieting, fasting, or excessively exercising. Number two is binge eating or purging type, in which person also engage in intermittent binge eating and or purging behavior. Okay. Next is bulimia nervosa. Individual with bulimia nervosa typical alternate dieting or eating only a low calories safe food with being eating on forbidden high calorie food. Common purging behavior include forced vomiting, fasting, laxative, diuretics, enemas, and excessive exercise. Okay, next is common symptom of bulimia nervosa include recurrent episode of being eating with a feeling of lack of control, recurrent episode of inappropriate purging behavior to present weight gain, self-esteem overly influenced by body shape and weight, a fear of gaining weight, despite having a typical week. Next is being eating disorder. Individual with this disorder with a symptom similar to those of bulimia, or the being eating subtype of anorexia. For instance, they typically eat unusually large amount of food in a relatively short period of the time and feel a lack of control during being. People with a being eating disorder is not require caloric or use purging behavior, such as vomiting or excessive exercise, to make compensate for the being. Okay, next, number 4, pica. Pica is eating disorder that involve eating things that are not considered food and that do provide nutrition value. Okay, individual with pica crave non-food substance such as ice, dirt, soil, chalk, soap, paper, hair, clothes, wool, pebbles, laundry detergent, or corn stripe. Individual with pica may be at an increased risk of poisoning, infection, get injury, and nutritional defenses. Depending on the substance inside it, pica may be fatal. Okay, next, number 5 is rumination disorder. Rumination disorder is under annually regulation eating disorder. It's describe condition in which a person regulated food. They have a frequently chewed and swallowed the chew it, and then either swallow is spit it out. This rumination typically occurs within the first 30 minutes after a meal. Okay, number 6 is avoided or restrictive food intake disorder. Okay, restrictive food intake disorder is a ARFID. It is a new name for an old disorder. The term has replaced the term feeding disorder of infancy and early childhood. This diagnosis presently reserved for children under age 7. Individuals with this disorder experience disturbed eating due to either a lack of interest in eating or distant for certain smell, taste, color, texture, and temperature. How do you know if you have an each other? Okay, if have an eating disorder, identify the condition and seeking treatment sooner will improve your chance of recovery. Being aware of the warning sign and symptom can help you detect whether you need to seek help. Not everyone will have every sign of symptom, and but certain behavior may signal a problem, such as behavior and attitude that indicate the weight loss, dieting, and control over food become primary concern. Okay, next is a preoccupation with weight, food, calorie, fat, germ, and dieting. Okay, next is refusal to eat restricted food. Next is discomfort with eating around other. Okay, food ritual, not allowing food to touch, eating only particular food group, skipping meal or eating only small portion, frequent eating or fat diet, extreme concern with body size, shape, and appearance. And last is a frequently checking in the mirror the perceived flaw in appearance. Okay, next is extreme mood swing. If the symptom resonate with you and you're thinking you may have a eating disorder, it's important to reach out to a medical professional for help. You're making the discuss to start eating disorder recovery may feel scary or overwhelming, but seeking help from medical professional, eating disorder recovery support group, and your community can make recovery easier. Eating disorder treatment. Eating disorder treatment plan a explicitly tailored to each person and may include a combination of multiple therapies. Treatment will usually involve talk therapy and with a regular health check with a physician. It's important to seek treatment early for eating disorder if the risk of medical complication and such is high. Treatment options include individual, group, or family physiotherapy. A type of physiotherapy called cognitive behavioral therapy, CBT, may be recommended to help reduce or eliminate disordered behaviors such being eating, purging, and restricting. CBT involves learning how to recognize and change distorted our unhelpful thought pattern. Medication, doctor may recommend treatment with medication such as antidepressant, antipsychotic, or mood stabilizers to help treat eating disorder or the condition that may occur at the same time, such as depression or anxiety. Nutrition counseling, this involves working with dieting to learn proper nutrition and eating habit, and may also involve restoring or managing a person weight of they have experienced significant weight change. Studies suggest that combining nutritional therapy with cognitive therapy may significantly improve treatment outcome. How to help someone with an eating disorder? If you think someone in your life has an eating disorder, your best be is to support and encourage them to seek help from a healthcare professional. This can be extremely difficult, someone living with an eating disorder, but supporting them in other way will help them feel great for and encourage in this recovery. Recovering from an eating disorder can take a long time, and this person may have a period for replacing into all behavior, especially during time of stress. If you are lost to person, it's important to be there for them and be patient throughout the recovery. Why to support someone with an eating disorder include, listening to them. Taking time to listen to their thought can help them feel respected and supported. Even if you don't agree with what they say, it's important that they know you are there from them and that they have someone to confide in. Include them in activity. You can reach out of invite them to activities and social events to ask they want to hang out one-on-one. Even if they do not want to be social, it's important to check in and invite them to help them feel relevant and less alone. Trying to build their self-esteem, make sure they know that they are valued and appreciate, especially for non-physical reason. Remind them why you are their friend and why they are valued. Thank you for today my presentation, and thank you for you all and my lecturer Dr. Razali. Assalamualaikum and bye bye.